Dear students, I am Dr. V. Premala Priyadarshini here with you to teach on the topic low sodium and low protein diet. In today's class, we are going to learn a short introduction on dietary practices in renal diseases, the objectives of this module, the different types of renal diseases, their onset, causes, symptoms, and their dietary management. To introduce, diet plays an important role in the management of therapeutic diseases. Preparing a diet chart for any therapeutic conditions requires a meticulous planning and a better understanding of the therapeutic condition. Dietary practices and lifestyle modifications has resulted in an escalating incidence of non-communicable diseases like obesity, hypertension, cardiovascular diseases, and renal diseases. Therapeutic management of these diseases are carefully done by either enhancing, including, excluding, or restricting one or more nutrients like calories, protein, fat, fiber, and sodium in the diet. What are we looking at in this module? This current module will focus you on the low sodium and low protein diet. Though a low sodium diet is recommended for patients with hypertension and cardiovascular diseases, a low sodium and a low protein diet is always prescribed for a patient suffering from renal diseases. With this prelude, let us see the objective of this module. The present module will enable you to gain basic knowledge on the functions of kidney, the onset of different renal diseases, causes, and their symptoms. It will also make you to understand the principle of diet and the dietary management of various types of renal diseases. The present module will enable you to gain basic knowledge on the functions of kidney, the onset of different renal diseases, causes, and their symptoms. It will also make you to understand the principle of diet and the dietary management of various types of renal diseases. Students, to start with, let us now learn the basics on how a kidney filters our blood. As we all know, we have a pair of kidney with more than 1 million of filtering units called nephron. Each unit of nephron is made up of glomerulus, a tuft of minute capillaries coiled inside a sac-like structure called Bowman's capsule. These functional units filter the blood that flows through the kidney. On an average, 130 ml of blood flows into the kidney every minute. Filtration of blood takes place due to the hydrostatic pressure exerted on the internal walls of the capillaries of glomerulus and is collected in the Bowman's capsule. The filtrate from the Bowman capsule passes through the proximal convoluted tubule at the rate of 100 ml per minute and then to the loop of Henle, from there to the distal convoluted tubule, and finally to the collecting duct. Based on the metabolic demands of an individual, a selective reabsorption of constituents like sodium, potassium, and water takes place. Out of 50,000 ml of water and 22,500 millimoles of sodium filtrate that passes through the renal capillaries, only about 1,500 ml of water and 100 to 120 millimoles of sodium is excreted every day. Remember that the blood constituents like leukocytes, erythrocytes, platelets, blood protein, globulin, albumin, prothrombin, and fibrinogens are retained by the kidney, and the water, minerals, salt, keto acids, glucose, hormone, urea, uric acids, toxins, and drugs are filtered and excreted. Now, having understood about the basic functionings of kidney, let us now see the important functions of kidney. Kidney excretes nitrogenous waste products like urea, uric acid, creatinine, and hydrogen ions and sulfates after the degradation of sulfur-containing amino acids. They also excrete a considerable amount of water, sodium, potassium, calcium, phosphate, and magnesium. The next function of kidney is to regulate and maintain the body fluids by modifying the composition of urine and other electrolytes. You know, they are the production site of 1,2,5-dihydroxycholecalciferol, an active component of vitamin D. Kidney also produces erythropoietin, which is essential for the synthesis of RBC. Yes, you're right, the red blood cells. Kidney stimulates the production of aldosterone, an enzyme to protect our heart from any shocks. Also, the degradation of parathyroid hormones, calcitonin, insulin, and gastrin takes place in kidney. Therefore, remember that an improper functioning of kidney leads to retention of sodium, elevated levels of urea, uric acid, and creatinine, resulting in acidosis, hypertension, hyperkalemia, calcium, and iron deficiency. Fine. Now you know the functions of kidney, but how will you find out whether the kidneys are functioning or not? Yes, for this we have a biomarkers to assess the renal functions. So can we now move on to the biomarkers in the assessment of renal functions? Elevated levels of urea, creatinine, sodium, potassium, bicarbonates, calcium, inorganic sulfates, and alkaline phosphatase in the blood and in plasma are the most inexpensive and convenient biomarkers of renal dysfunction. Since creatinine is excreted completely by glomeruli, the rate of creatinine clearance serves as an excellent indicator of glomerular filtration rate. The GFR can be calculated using the formula UV by P, where U is the creatinine concentration in urine, V is the volume of urine excreted in 1 minute, and P is the creatinine concentration in plasma. The normal GFR is about 100 to 125 ml per minute. GFR less than 30 ml per minute indicates renal failure. The normal rate of creatinine clearance is 125 ml per minute. Elevated plasma potassium, phosphate, and bicarbonate concentrations are also the indicators of renal failure. Never forget that the volume of urine may be increased, decreased, or normal at different stages of acute and chronic renal failure. Always keep in mind that the presence of blood and protein in the urine is also a good biomarker of renal dysfunctions. Don't you now agree that the above biomarkers are important tool to diagnose the various diseases of kidney? Okay, what next? Yes, you got it right. It's types of renal diseases that we are going to see now. Glomerulonephritis, nephrotic syndrome, acute renal failure, and chronic renal failure are the different types of renal diseases. Now let us study the onset, symptoms, and dietary management of renal diseases in detail. The inflammation of glomerulus is termed as glomerulonephritis. Dear students, note that the incidence of glomerulonephritis is most commonly seen in children between the age group of 3 to 10 years and in adults over 50 years. A progressive glomerulonephritis will lead to nephrotic syndrome. Toxic venom, drug allergies, malarial infections, and diabetes are also the contributing factors for nephritic syndrome. A progressive nephrotic syndrome, metabolic insult, or a traumatic injuries due to the accidents or burn can cause an abrupt shutdown of renal functions, and this condition is called as acute renal failure. On an alarming note, when 90% of renal tissues are destroyed due to the end result of either acute glomerular nephritis, nephrotic syndrome, or an acute renal failure, the chronic renal failure sets in. Are you curious to know what exactly happens and how does a renal dysfunction sets in? Let me explain it to you in a much simpler way. Students, rewind your memory on antigen and antibodies before we start with the onset of the disease. The presence of antigens in the form of any bacterial, viral infection or chemicals result in the formation of antibodies against the antigen. Yeah, you're right. Antigens are any foreign substance that interact with our body, and antibodies are chemicals or enzymes that are produced by our immune system to fight against the antigen. Prolonged infection or severity of infection leads to the excess circulation of antigen-antibody complex in the blood. When blood enters the kidney for filtration, the glomerulus traps the antigen-antibody complex, which in turn attracts the leukocytes. The leukocytes releases lysosomal enzymes to act against the antigen-antibody complex, causing an injury to the glomerulus. Repeated deposition of antigen-antibody complex results in the formation of a lump between the epithelial membrane of the glomerulus and the nephron. Due to the internal pressure exerted within the glomerulus and the nephron, lesion develops, fibrinogen leaks into the Bowman's capsule, forming a scar tissue. As a consequence, the circulation in the glomerulus is obstructed, leading to fatty degeneration, necrosis, death of glomerulus or nephron, and finally the destruction of nephron. As we already know that nephrons are the functioning units, any reduction in the number of nephron leads to renal failure exhibiting certain clinical symptoms. Renal infarction, acute polynephritis, metallic poisoning also causes glomerulonephritis. I hope now you are clear with the onset of renal diseases. Can we now move on to the clinical symptoms of renal diseases? The classical symptom of renal diseases are hematuria, presence of blood in the urine, proteinuria, presence of protein in the urine, edema and shortness of breath due to the retention of sodium and water and circulatory congestion, presence of tachycardia and elevated blood pressure. Patient is generally anorexic, meaning lack of appetite, acidosis due to accumulation of non-volatile acids in the blood, anemia due to bleeding and hematuria. The patient is normally lethargic, dehydrated, nausea, vomiting and water intoxications are the other symptoms, and a glomerulus filtration rate less than 5 ml per minute in case of chronic renal failure. You have to plan a diet with normal calories, an adequate protein if oliguria and anuria are not there. A low protein diet is recommended if oliguria and anuria are present. A low sodium to manage hypertension and edema. Fluid intake should be planned based on urinary output, vomiting and diarrheal losses. With this principle of diet, now let us see how we can plan the dietary management to maintain the nutritional status of renal patients. Students, remember that it's always wise to reduce the fluid intake as a first step in the dietary management to reduce edema. Daily weighing of patient is mandatory to check the overall fluid balance. Once edema is treated, the fluids can be adjusted based on the volume of fluids excreted with an allowance of 500 ml per day for insensible water loss in the form of sweat. Keep it in your mind that water used in the preparation of dal, curries and the one consumed with their drugs should also be taken into account when you are planning the diet. The daily fluid replacement should be 500 ml plus daily amount excreted in the urine. Insensible water loss can be calculated as 30 ml per kg of body weight for infants, 20 ml per kg of body weight for older adults and 10 ml per kg of body weight for adults. If the patient feels thirsty, the urge to quench the thirst can be managed by sucking ice cubes, lime-rich, eating sour candies, chewing gums to moisten the mouth. Water allowance should be put in a container and the patient should take from the container only. I hope you're clear with the fluid recommendations. Can we now move on to the caloric or energy recommendations? To start with, caloric intake should be increased without increasing the protein intake. The recommended caloric requirement for the children is 80 kilocalories per kg of body weight with an extra allowance of 10% to meet out the metabolic demand of the body due to infection. Inclusion of sugar, honey, glucose, sago, fat and oil and starchy food in the diet may increase the caloric requirement without increasing the protein requirement. Also, the above mentioned sources are poor source of sodium and potassium. A liberal allowance of carbohydrate will prevent depletion of fat storage and subsequent complication of ketosis. The next nutrient that we have to concentrate is protein. An intake of low protein of 20 to 40 grams per day or 0.5 grams of protein per kg of ideal body weight for older children and 1 to 1.5 grams per kg per day for younger children should be recommended. In case of elevated plasma level of urea, uric acid and creatinine, in case of acute and chronic renal failure, protein should be restricted less than 20 grams to give rest to the kidney. Protein should be eliminated in case of anuria and in end-stage renal failure. Also note that no protein restriction is required if the creatinine clearance is 40 ml per minute or above. However, 40 grams of protein can be given if the patient is on a hemodialysis or on peritoneal dialysis. It's always wise to plan a diet with a high biological protein from animal sources like meat, egg and milk for effective utilization. Restrict the usage of pulses and groundnuts as they may increase the urea level in the blood. Fruits and vegetables which are usually low in protein can be prescribed. Care must be taken to choose fruits with poor source of sodium and potassium. Look into your nutritive value books to find out the low sodium and low potassium fruits. Now let us pass on to the recommendations for sodium. Sodium should be restricted depending on the degree of oliguria and hypertension. If renal function is impaired, as in case of acute or chronic renal failure, a restriction of 500 to 1000 milligrams per day of sodium should be recommended. Allowance of sodium can be increased as the patient recovers and is free from edema. Remember to restrict sodium if edema still persists. The patient should be advised to avoid addition of salt during cooking or on table, intake of cakes and pastry products like puffs, cookies, biscuits and muffins as they contain baking soda and sodium bicarbonate. Strictly instruct the patients to eliminate foods like preserved fruit juices, squashes, jams, jellies, papads, pickles and all kinds of processed and ready-made preserved foods, since they are loaded with preservatives like sodium benzoate and potassium metabisulfates. Instead, the patients may be recommended to consume foods like radish, bitter gourd, snake gourd, chow chow, pumpkin, beetroot, no-code, jaggery, sago, restricted quantities of milk, egg, meat and curd. To recapitulate, so far we have seen the dietary modification for energy, fluids, protein and sodium. Now let's see the recommendations for potassium. Students, either in case of acute renal failure or chronic renal failure, the potassium is not excreted and hence it accumulates in the body, leading to hyperkalemia, an elevated level of potassium in the blood, causing tachycardia, meaning uneven heartbeat, or even bradycardia, meaning very low or no heartbeat, a condition which is life-threatening. Hence, patients should be educated on the importance of potassium in their diet. The old school of thought is to leach the potassium from fruits and vegetables before cooking. Leaching is a process in which fruits and vegetables are cooked in excess water and draining the vegetable. But currently, leaching is not advised since doctors find it difficult and dangerous to treat hypokalemia, the low potassium levels in the blood, than to manage hyperkalemia. Do not forget that potassium is found naturally in almost all foods, particularly in fruits and vegetables and meat. Fruits like pineapple, pomegranates, plantains and sapota can be recommended. Now let us see what should be the recommended intake of fat. A moderate intake of fat should be recommended. 20% of caloric requirement should be met by the fat. The patient should be encouraged to use polyunsaturated fats like groundnut oil, gingerly oil, sunflower oil, rice bran oil and olive oil in their regular diet. It is always better to limit the consumption of saturated fats like butter, ghee and cheese. Recommend your patients to practice healthy cooking methods like boiling, steaming and microwave cooking rather than to deep fat frying or baking. I hope you're clear with the recommendations of fat. Shall we now make a move to phosphorus, yet again an important nutrient of concern. Phosphorus is a mineral found in almost all foods. Milk, cheese, nuts, dried beans and peas are rich in phosphorus. Intake of phosphorus-rich foods should be restricted since an elevated level of phosphorus can cause demineralization of calcium from bone. As a result, the bone becomes weak and fragile, posing the risk for fracture. To summarize, let us remember that an impairment or a sudden shutdown of kidney leads to renal failure. Hematuria, proteinuria, edema, shortness of breath, anorexia, acidosis, anemia, dehydration, nausea and vomiting are the symptoms that you should be familiar with. Plan a diet with normal calorie, adequate protein. Recommend a low protein diet if oliguria and edema are present. Remember to give a low sodium to manage hypertension and edema. Compensate fluid intake according to the urinary output and insensible water loss in the form of vomiting and diarrhea. Never forget that your main goal in the dietary management is to give a balanced diet to maintain a nutritional status and reduce the risk for complications. Also, make sure you plan a diet which is economical, easy to prepare and follow. Avoid monotony and be patient friendly. Students, prevention is better than cure. Educate and reinforce your patient to eat healthy foods, drink plenty of water, and to exercise, to be active, to lead a healthy life. Thank you.